Metabolism of fluoride. After ingestion of fluoride orally, it will go to the digestive tract. Some of these fluoride will excrete through feces, and the other will go to the circulating system through the blood, and then it will be distributed to the all part of the body, to the placenta, the saliva, teeth, bone, sweat glands, urine, soft tissue, and milk. About 99% of fluoride will precipitate in teeth and bone. These are the calcified tissue, so most of fluoride will precipitate in these tissue. Mechanism of action, or how fluoride will reduce dental caries. This is occur first by decrease the solubility of enamel in acid by converting hydroxyapatite into less soluble fluorohydroxyapatite or fluoroapatite. First, the fluoride ion will substitute the hydroxyl group in the enamel crystal. This will decrease the crystal dimension because fluoride is smaller. Also, the strong attraction between fluoride and calcium will lead to more stabilized lattice structure and improve the crystallinity of the crystal. So, the fluorohydroxyapatite or fluoridated hydroxyapatite is more stable than hydroxyapatite crystal. This slide also shows us how fluoride prevents dental caries and reduce demineralization, as the fluoride will substitute the hydroxyl group in the enamel structure and form fluorohydroxyapatite, which is more acid resistant, and as a result the enamel becomes more resistant to caries. Other mechanism of fluoride is enhanced remineralization of enamel in areas that have been demineralized by acid. When fluoride present in low sustained concentration in the oral fluids during an acid challenge, it is able to adsorb to the surface of the apatite crystals and inhibiting demineralization. لذلك الفلورايد هيكون قطاع حول الكريستال ويمنع demineralization of this crystal by acid. Other effect of fluoride is the antibacterial action. Fluoride acts as bactericidal in high concentration and bacteriostatic in low concentration, as it will affect the oral bacteria and dental plaque ecology by affecting the enzyme of these bacteria and their metabolism in the oral cavity. So it inhibits bacterial adsorption and decreases acid production of plaque bacteria. The other effect of fluoride is the improvement of the tooth morphology, making them more self-cleansing. This occurs in the period of tooth development. Fluoride ion, when present in low level in saliva, about 0.01 to 0.10 mg per liter, depending on the fluoride level in drinking water, will lead to effect on enamel crystal, dental plaque, and cells and the fluids of the dental tissue. All these will have cholestatic mechanisms in different ways, and as a result will reduce dental caries. Side effects of fluoride. Fluoride is a hazardous substance when it is taken in large doses acutely or when it is taken in low doses chronically. So the side effects of fluoride include dental fluorosis, reversible gastric disturbances, skeletal fluorosis, and death when it is taken in large dose for one time. Dental fluorosis is hypomineralization of enamel results from excessive fluoride ingestion during tooth development. This is the mild fluorosis as in this picture on the left, and this is the severe fluorosis as in the picture on the right. The fluorosis will occur if there is over intake of fluoride, especially in the first 6 years of life. It is less in primary teeth because these teeth will develop prenatally. Also, the most critical period is between 15 to 13 months of age. This is especially because the maxillary center incisor will develop in this period. How we measure dental fluorosis? This is done by using different fluorosis index. The most common one is Dean's Dental Fluorosis Index in 1942. This index includes many scores ranging from 0 to 4. The score 0 is the normal dental tissue. The questionable type, which is given a score of 0.5, in which there is a few white flakes or white spots. The very mild type given a score 1, which includes small, big, paper white areas covering less than 25% of the tooth surface. The score 2, which is the mild one, include opaque white areas covering less than 50% of the tooth surface, while the moderate, which given a score 3, in which all tooth surfaces affected and there is mild wear on biting surfaces, brown stain may be present also. The severe type, which is a score 4, include all tooth surfaces in which the secret or confluent pitting brown stain present, a corroded-like appearance also present. The picture on the left is the very mild one, and the second picture includes the mild type. The third picture is the moderate, and the fourth picture is the severe type. How we could prevent dental fluorosis? Dental fluorosis could be prevented by adjustment the level of fluoride to the optimal or suboptimal level. If there is a high level of fluoride in drinking water of an area, so there should be an alternative water supply for this area. If this is not possible, so the available drinking water can be defluoridated. فإذا كان نسبة الفلورايد في الماء عالية، نستطيع إذا ما وفرنا البديل لهذه المنطقة نستطيع سحب الفلورايد من الماء بعملية defluoridation of water. So defluoridation of water is the downward adjustment of fluoride ion concentration in public water supply to be maintained at 1 part per million by weight. طبعا هناك أجهزة مختلفة لسحب الفلورايد من الماء ومنع الدنتال فلوروسيس. شكرا لإصغائكم، أتمنى تكونوا فهمتوا المحاضرة وأنا حاضرة لأي سؤال.